Hello, everyone. I'm Dr. Angela Mattke, and you're watching Ask the Mayo Mom on Mayo Clinic's Facebook Live. I'm a pediatrician at Mayo Clinic Children's Center, and twice per month I host a show about pediatric health topics where we take and answer your questions live. Today, we're talking about Pinkeye, also known as conjunctivitis. And joining us for this discussion is Dr. Marcie Billings, who is a pediatrician and the division chair of the Community Pediatrics and Adolescent Medicine within the Department of Pediatrics at Mayo Clinic Children's Center. She's also an assistant professor of pediatrics at Mayo Clinic. Dr. Billings has worked closely with others at Mayo Clinic to align its conjunctivitis management in accordance with the Minnesota Department of Health, the CDC, and the American Academy of Pediatrics recommendations, including return to school and daycare guidelines, which we will be discussing later in the broadcast. It's going to be a great discussion today, so please send in your questions and comments under the Facebook Live video feed, and we will try our best to review them during the live video broadcast today. And if we don't get to them during the broadcast, we'll be sure to answer your questions after. So, Dr. Billings, thank you so much for joining us today.
Great to be here. Thanks for having me.
It's great to be here. You've been a mentor for me my whole life, so I'm so excited to have you here sharing your expertise with everyone.
Thank you.
Yeah. Well, let's get started talking about what actually is Pinkeye. What is conjunctivitis? For us, it's bread and butter, but for parents, sometimes it's hard to know what these medical terms mean.
Absolutely. So most people call it Pinkeye, but again, conjunctivitis is the correct terminology. It's really just an inflammation of the conjunctiva, which is a little thin membrane that covers the white of the eye, or the sclera, as well as the underside of the eyelid. And so what happens when it gets inflamed is the blood vessels become more obvious, which causes that redness, which we perceive and then call it Pinkeye.
Yeah, and we have a picture of it. Why don't we pull up that picture and you can kind of explain to us what we're seeing here.
Right. So what you're seeing there is a bit what I described, those real prominent blood vessels that you see over the whites of the eye, as well as some inflammation there. And then what we didn't talk about, but we will talk about, I'm sure, is some of the symptoms that come up, which is discharge and drainage.
Yeah. So what else? So what other things would a person experience when they have conjunctivitis?
Right. So along with the redness and the swelling of the eye, you can get some drainage that can run anywhere from somewhat clear to thin to thick. You can have some gritty feeling in the eye, as well as feeling like there's something maybe in the eye, some itching, burning. Typically, those are the main symptoms that people have.
So what are some of the causes of conjunctivitis?
Right. So the main cause is viruses, and bacteria can be another cause. Those are obviously contagious, as we all know. But other things that aren't contagious can cause conjunctivitis, things like allergens. So when people have their seasonal allergies, they can have a component of conjunctivitis with that. And other things like irritants, whether that be chemicals or smoke or dust. Contact lenses can be an irritant to the eye, and so things like that can also cause it. But again, those aren't contagious.
Right. So viral and bacterial are probably the more common reasons that we tend to see people coming into our office with it.
Absolutely.
Okay.
Yes.
So how do we kind of sort through, or how can parents kind of start to assess and sort through whether they think it's viral or bacterial?
Right. Well, to start off, that is actually kind of challenging.
It is,
because there is a lot of things that can be similar across the different sources or reasons for the conjunctivitis. Again, viral conjunctivitis being the most common, and bacterial too, all of them are going to have a bit of that redness and swelling. So that's going to be consistent across all types of conjunctivitis. The discharge is also something that is pretty consistent. On average, viruses are going to be a little bit thinner, maybe not as mucousy looking, and definitely not as persistent. So the classic somewhat differentiation between virus and bacterial could be that, gosh, all kids are going to wake up with kind of that crusty eye in the morning, which gets our attention. But after you wipe it away, viral conjunctivitis doesn't usually cause that much of a drippy eye throughout the day. Maybe a little bit where you'll see it kind of accumulate in the corners of the eye. Versus bacterial conjunctivitis is going to be kind of drippy all day long. So continual just production of the mucus as it's coming through the eye. The allergic conjunctivitis is, again, more on that kind of clear, thinner. Allergic conjunctivitis is going to be more associated with probably intense itching and irritation that way.
Okay.
The other thing that you can kind of differentiate is typically the virus is going to be associated with other cold symptoms. versus the bacterial conjunctivitis might be associated with something like an ear infection or another bacterial cause. Versus allergic conjunctivitis, if someone with known allergies is in that season that they know they're always affected, they might be sneezing, kind of a clear runny nose associated with it. Other people in the family with allergies might be experiencing similar symptoms. So those are some ideas or ways that we can differentiate all three.
Yeah, but it's hard.
It is hard.
Yeah, and sometimes you're not going to know right away, right? Because symptoms can sometimes change and manifest.
Yes, and so that's where, I mean, again, typically most causes of conjunctivitis are not going to have any long-standing consequences. They're gonna be present, and then they're gonna be there and go away on their own without any consequence to the eye or vision. Okay. So you can have some time for most cases to be able to kind of see where the inflammation goes.
Okay, we have a great audience question coming in. They want to know about how transferable is it, or how infectious is this?
Yeah.
Is it different than the common cold? Do we have to be more concerned?
Right. That's a great question. And really it is contagious, but no different than the common cold.
Exactly. Yeah.
So that's exactly how I would consider it. Okay. So, most of us, we get colds a lot. Kids get colds a lot. I would think of this as kind of an eye cold. Okay. So just like you have a runny nose, you're going to have a runny eye.
Absolutely.
Yep.
What about, how long can you expect these symptoms to last? Is it similar to how long the cold symptoms would last?
Yes. So for the most part, it's going to last typical for like a common cold, maybe 3 to 5 to 7 days. Okay. It can be prolonged, but in that time frame, it shouldn't be getting worse. Okay. So usually it gets worse in the first couple days and then kind of stabilizes and gets better over time.
Oh, that's a great segue. So when should parents be bringing their child in? When is this concerning? When do they need to see a provider?
Absolutely. So there's a couple indications that are kind of we need to see you. Yeah. So that's going to be something like if you've got an immunocompromised child or person with symptoms. That's going to also be if you've got a neonate or a newborn in those first 2 to 4 weeks of life, as well as contact lens wearers. So if a contact lens wearer starts to have symptoms, really the best recommendation is take those contact lenses out, put your glasses on, and if you're still symptomatic in about 12 to 24 hours, best to be seen. Okay. Aside from that, then there's other things that could be helpful to determine if we should come in. Eye pain is something that we typically don't see as much with just your mild cases of pinkeye or conjunctivitis. Any visual changes or light sensitivity would be another thing that would recommend that we see you. We talked about the symptoms lasting about 3 to 5 days and then kind of stabilizing and getting better. If symptoms get worse or don't get better if you're receiving treatment, those are reasons to come back in and be looked at. So those are kind of the main ones to be aware of.
Okay. You mentioned neonates or infants that are like pretty young, less than 2 weeks of age. Why are we more concerned about them?
Right. So a couple reasons. So there is a condition that can affect newborns, and it's typically related to the birthing process and infection passed from mother to child. So things like chlamydia and gonorrhea, even if mother is unaware or asymptomatic, she can pass those infections to her infant, and that can cause significant eye complications. So any newborn that has conjunctivitis symptoms, no matter how mild, those are situations where we would need to see that child.
Absolutely. So we mentioned some of the other concerning symptoms that parents should be bringing their child in for if they're present. They're probably because we're thinking of other things. What are some other things that maybe look like conjunctivitis but aren't conjunctivitis?
Right. So in that population that we just talked about, even the newborns, although we're still going to see them, we might end up with a diagnosis of a lacrimal duct obstruction. So there's a little tube that kind of helps drain the eye that can get a little bit, we call it clogged, but it's just that it's kind of really narrow. And so the eye doesn't drain as well, and so they can have some drainage. So we might end up diagnosing that. That really doesn't typically require antibiotics, just some nice gentle massage on the lacrimal duct and symptoms improve over time. There can be other situations of kind of chemical irritation, foreign bodies, contact lenses can cause problems and similar symptoms.
Okay. So where the patient is in our office and they're there with these symptoms, what would be the treatment to help them with their symptoms and make things better?
Yeah.
Or is there not always something that we can give them?
Oh, there's always something we can do. And so most often we're going to diagnose a conjunctivitis that's caused by a virus or bacteria. And again, viruses and most bacterial mild infections are going to go away on their own and are not going to be responsive to antibiotics. But we can do some supportive things. So, helping the children with a cool or a warm compress, whichever one makes them feel a bit better, helping to wipe away the drainage, especially in the morning. That's when they're most fussy because they wake up with their crusty eyes. Right. And just making sure too, to help with maybe some preventive efforts. And as you're helping your children, making sure that you're washing your hands and things like that.
Absolutely. We have a great audience question, and they're wondering if there's any specific over-the-counter eye drops that can be helpful in treating like the viral symptoms.
Absolutely. That's a great question. So yes, just the artificial tears can be really helpful just to kind of coat and soothe the eye, provide a little bit of moisture there. You do want to avoid the kind of red out type medications. That actually can cause a little bit more irritation for those with these types of conjunctivitis.
Okay. A lot of times in the office, the question and the concern that parents have is that they need antibiotic drops to be able to send their child back to daycare. Does all conjunctivitis need antibiotics? And why would we not want to use it?
Right, absolutely. So as we talked about, the most common cause of conjunctivitis or pink eye is going to be a virus. And I think we know these days that viruses don't respond to antibiotics. And the challenge with giving antibiotics when we don't need it is that issue of antibiotic resistance. And so we are trying to be good stewards of use of our medications and really saving those antibiotics for when infections really need them. Sometimes people will say, well, gosh, I was treated with an antibiotic and my pink eye went away so quickly. Most likely is that was the course of the illness, and it's somewhat of a coincidence. I know that's hard to sometimes swallow, but that is usually what's going on. But yes, we really don't feel that antibiotics are going to be helpful for any viral conjunctivitis, and typically most mild bacterial conjunctivitis will go away on their own and not see much benefit from antibiotics as well. Now, there is a place for antibiotics.
Okay. Tell us about that.
Yes. Yeah. And so, if things are not getting better, if symptoms are more problematic, then yes, we might consider that. But again, for those reasons we talked about previously.
Okay. Well, that gets into a really big conundrum for families in schools is, does a child need to stay out of school and stay out of daycare if they do have conjunctivitis present?
Right. And this is a great time to be talking about this because things here in Minnesota have changed recently.
Absolutely. Tell us about that.
Yes, right. So in April of this year, the guidelines from the Minnesota Department of Health were updated and revised to really show that kids with conjunctivitis do not need to be excluded from school or daycare facilities. Now, if they have other situations or conditions that are prompting it, things such as fever associated with it, or they're so unhealthy with the condition that they're not able to participate in the daycare or school activities. Or one could extrapolate a little bit further and say that the daycare people are spending too much time dealing with the child's illness, that they can't take care of the other kids appropriately. Right. Those would be reasons to have that child stay home. But just a mild case of conjunctivitis where there's no fever and the child is otherwise acting fine, just as you would have your child with the common cold with no fever attend school. Again, remember what we talked about before. This is a cold of the eye. Like a runny nose, it's a runny eye. Those children can be in school or daycare. They do not need a note from their provider, and they do not need antibiotics to return to, or they shouldn't have even been excluded, but if they stayed out for a reason, they don't need antibiotics or a note to return back.
Okay. And the Minnesota Department of Health and Mayo Clinic has updated their guidelines to be in accordance with kind of new research, or not necessarily new research, but just in accordance with research and what the Centers for Disease Control is also saying, and the American Academy of Pediatrics, right?
Absolutely. Okay. So the American Academy of Pediatrics really does a great job in terms of showing that this is no different than the common cold, and really talking about even getting in more depth of this is one situation where kids can be infectious. So there are multiple situations, even if you think about the context of conjunctivitis illness, there can be kids that don't have symptoms that are still a bit infectious beforehand. They could be carrying the virus and not really showing symptoms and could potentially be infectious. Obviously, when they have symptoms, they could be infectious. But these viruses are shed for a long time after the child is better, where you would typically think to send them back to school or daycare. So in order to completely reduce the infectious nature, to keep a child out for that long of a time period would be pretty devastating to a child's education, to families' employment, financial issues. And so, and there's really been no studies to show that doing so is going to really reduce that infectivity, especially when you target only one of those areas.
Absolutely. So how can we help parents know if they did keep their child out of daycare or school because they weren't able to participate or things like that? What kind of symptoms would show them that it's okay to send their child back now?
Right. Again, I would do it just like you have with the common cold. If your child's still a bit symptomatic, but you can't keep them sitting down and they're running around and they're eating good, and you think that they can participate fully in the day ahead of them, then I would send them. No fever, obviously, as well.
I think this is going to be, it's just a really big change in the way we process things. I think it's going to be for schools and for daycares and for families to understand that, we've kind of stigmatized conjunctivitis in a way, making it think it's more infectious than other things, but in reality it's not.
It's not. Yes. No. And if I can do one take home for this whole conversation, it's the common cold association.
Right. I think as a parent, you see your child with red eyes and you think, oh no, I have to get them in. I have to get them, they're going to miss school. I'm going to miss work. I have to get the antibiotics so we can get back as quick as possible. But that is just such a different mindset that we're trying to change because it's inappropriate treatment, right?
Correct.
In most cases.
Right.
Yeah,
right. Yes.
absolutely.
Yes. And again, getting into that conversation we had before, that if we do just put antibiotics on based on those symptoms, the majority of kids are going to be treated inappropriately with antibiotics, which could cause problems down the line with resistance.
Absolutely. And in our protocol at Mayo Clinic, we sometimes used to do antibiotics via phone triage. Can you talk a little bit about that and why it's so important to bring them in so we can kind of assess if we need to?
So about a year ago, we did, based off of research, really decide that our protocol, which was to do those antibiotics, again, because the guidelines were different for school and daycare, we would give antibiotics and really looked hard at that and decided that in accordance with the groups that we've talked about, that was not what we were going to continue with. So our protocol was discontinued, and then we worked closely with the external agencies to really start helping the community get on board with it at once. So we really did kind of a collaborative approach back in April. So April is when the Minnesota Department of Health updated their guidelines, and then our cease of the protocol happened a few weeks after that. It also happened kind of towards the end of the school year, when conjunctivitis that time of year is not as common, and letting people kind of get used to things a little bit over time. But again, I think it's a really good move. I think it's been a long time coming. But yeah, there'll be some challenges and bumps along the way.
Absolutely. It's going to just take a little bit of time to kind of get used to this process.
Yeah.
What about little kids? I mean, they're touching everything. They're touching their nose constantly. They're touching their eyes. They're touching their friends.
Right.
What can we do to kind of decrease the risk of transmission?
Right. So the best is going to be the obvious of washing hands. And so, making sure you wash your hands with soap and water, or if that's not available, an alcohol-based hand sanitizer. And especially really thinking of those that work with the children. So the daycare providers, the school personnel, but the children themselves. So as much as we can. And I know that you could wash your child's hand and 2 seconds later they're going to do something different, but that doesn't take away from the need to still recommend that. Really helping people to try and minimize the touching of the eyes, and not using things that other people use. So not sharing cloths or rags or Kleenexes or things like that. The older children not sharing makeup or other things that could touch one person and then transmit it that way. But yeah, I mean, it's a lot of hand washing, but it's what we do for the common cold as well. Daycares and schools can can also disinfect, as they do with their policies and such, as per standard. So it's no different for conjunctivitis. It's just what we would expect for typical hygiene-related practices in those settings.
Perfect. We have a great audience question again. So, should you be concerned if your child has pink eye more than once in a year? Does that raise concern for anything specific?
Again, I'm going to go back to the common cold and viruses. Boy, in the winter months, we have viruses for kids about once a month on average from October through April. And so it would not be surprising if a mild conjunctivitis with each of those was present. Again, if it starts to be an outlier where there is prolonged symptoms, eye pain, sensitivity, symptoms are getting worse than better, then that is something that I would be seen for. Okay. I do want to put at the end of this, at any time, if a parent has a concern, even if what our advice is going to be is, nope, this is still, well within normal, we want you to call us. We want you to come in, and we are happy to evaluate and answer those questions and give reassurance. Absolutely. Or if there is something different, we'll speak to that as well.
Because we're not saying we'd never use antibiotics. It's just that we want to be cautious with how we approach it.
Absolutely. Okay. Absolutely. Okay. It would be a minimal and not common occurrence to use antibiotics, but there are definitely indications for that.
Okay. Sounds good. We have another great audience question about contact lenses. So are there any special precautions that they should use when they either to prevent conjunctivitis, or if they do get conjunctivitis, when they can start using them?
Yeah, so that's a great question. So at first sign of conjunctivitis, the recommendation is to take your contacts out and not wear them until symptoms are gone. Okay. If you have disposable lenses, it would probably be best to throw out the one you were wearing and use a new one. If you don't have disposable, then really good cleaning of those lenses. Again, always talking to your eye doctor if you have questions beyond that.
Absolutely.
Yeah.
So what resources would you recommend for patients and families if they have any more questions about conjunctivitis or pink eye?
Absolutely. So obviously within the Mayo Clinic, we have resources on our website for this. And again, those that we've talked about, those external agencies, the American Academy of Pediatrics, the Centers for Disease Control, and the Minnesota Department of Health all have wonderful conjunctivitis topics on their websites.
Fantastic. And I know I've used them as well too.
Yes.
Absolutely.
Yes.
Well, that's all the time we have. Is there anything else that you wanted to add?
No, I appreciate the opportunity to talk about this because things have changed a little bit, and hope this provides some education and a little bit more comfort with what we're doing.
Absolutely. I feel more comfortable. That's
Great.
for sure.
Great.
Thank you everyone who watched and sent in questions and joined the discussion today. Thank you so much, Dr. Billings, again for joining us.
Absolutely.
You can catch the next Ask the Mayo Mom Facebook Facebook Live video question and answer session on August 22nd at 11 a.m. Central Standard Time. Our topic will be kidney transplants in children, and we will be discussing pediatric kidney transplants with renal transplant surgeon Dr. Mikel Prieto and pediatric nephrologist Dr. Carl Kramer. Thank you everyone who joined and watched, and have a wonderful day.